So what is endometriosis? Endometriosis is a condition where the lining of the uterus, the tissue, starts growing in areas outside the uterus, like in the ovary, around the tube, on the surface of the uterus, and around all the other organs in the pelvis. Some important facts of endometriosis. Endometriosis is seen in 10% of women worldwide. That is, 1 in 10 women may be suffering with this condition called endometriosis, and it is thought that maybe it happens because of a retrograde menstruation. That is, the period which happens in a woman is not only happening through the vagina, but there is a reverse menstruation happening through the tube, because of which this blood is accumulating in the pelvis, causing inflammation, depositing around the organs, collecting and distorting the anatomy within the pelvis, and causing so many unpleasant symptoms for the woman. Now, what are the symptoms a woman may have if she's having endometriosis? She may be having severe pain during periods. She may be having excessive bleeding, pain during intercourse, chronic lower abdominal pain, which is very uncomfortable. These are common symptoms a woman may present with, other than presenting with infertility. We also see so many women having endometriosis and not having symptoms. But this endometriosis also causes infertility in the woman, and that is how the woman presents to us fertility specialists, and that is when we diagnose that they have this condition. How do we diagnose it? The most common way of diagnosing it is 1, through suspicion, 2, through doing a proper 2D, 3D ultrasound assessment of the pelvis. We can actually diagnose this condition, and when in doubt in certain cases, we may also advise an MRI to understand the extent of the disease. Did you know that endometriosis is a recurrent progressive disease? That is, even if we are going to suggest, say, a laparoscopy to clear the endometriosis, which is a keyhole surgery to clear the disease, there is always a possibility of it recurring, and that is why it is very important that the surgery, the primary surgery, is done by an endometriosis expert surgeon who clears the disease to the maximum extent so that we can decrease the recurrence rate. So if you have endometriosis, what you need to understand is you should not delay taking treatment. You should consult an expert team dealing with endometriosis. You may face fertility issues, or you're already facing menstrual issues, and you may be suggested a surgery to deal with this condition, and you may face fertility issues for which you may require treatments like IUI or IVF in future.